Excellency, President Felix Tshisekedi, Chairperson of the African Union, Excellency President Cyril Ramaphosa, the African Union Champion for COVID-19, Excellency President Macky Sall, Excellency Moussa Faki, Chairperson of the African Union, Dr. John Nkengasong, Director of African CDC, Madam Ngozi, Director General of WTO, distinguished ladies and gentlemen, WTO Director General Tedros. I want to begin by thanking the African Union Commission, led by Chairperson Moussa, and Africa CDC for convening this timely conference. Vaccine equity cannot be guaranteed by goodwill alone, as we have seen many examples to convince all of us. Africa needs to expand production capacity for vaccines and other essential medical products. I can't agree more with President Cyril Ramaphosa. In line with our agenda of increasing domestic health financing, it is important for Africa to forge strategic public-private partnerships for vaccine manufacturing on our continent. Let me add here, Excellencies, that in the past few weeks and maybe months, I had the opportunity to initiate contacts with different manufacturers of vaccines, specifically focusing on the messenger RNA technique used, say, by Moderna and Pfizer. And we have been involved in the discussions, and I have briefed a few colleagues on our continent, but we want to take this forward by discussing it with others, where there is a company that is capable of this technique, just as Moderna and Pfizer have been doing, that is ready and willing, and we have been having these discussions. I will brief those responsible very soon. Sorry that I had not done that before we had this discussion. But the whole idea is now how we can also have this type of capability on our continent, which really complements other ways, like the adenovirus method, the vaccines used by Johnson & Johnson, AstraZeneca, and also South Africa, in Aspen, they have that capability. But I think the future also is about the messenger RNA, and I think in the audience there are people even better informed than myself. But I think complementarity is better achieved and if we focus on that. And therefore, for Africa, move from being really very sorry for ourselves, which is the case today, and I think no one, maybe single person, takes the blame for that, but we have to overcome that and move from what we know has not worked for us, for Africa, well, to something we can do and we are able to do, given a few examples, again, President Ramaphosa mentioned, by partnering with these industries. So, President, I say the African Continental Free Trade Area makes these investments even more attractive. The African Medicines Agency Treaty is also a critical part of the institutional framework, and I urge African member states to ratify this, as many as we can have ratified as soon as possible. I also commend Chairperson Musa for naming a special envoy for the African Medicines Agency, Dr. Michel Sidibe. Vaccine production goes hand in hand with increased investments in domestic health systems, as well as building an efficient and autonomous African CDC, which I think is the way we are headed. Rwanda is ready to play a role in this effort, together with other member states and partners. And on this note, I thank you very much for your kind attention.